Hey everyone, and welcome back to another episode of the Digital Dentistry Decoded podcast. Today we have a very special guest, the co-founder and current CEO of Pearl, the people that make second opinion AI and arguably have revolutionized AI diagnostics in dentistry, Ophir Tanz. Welcome to the podcast, Ophir.
Thanks for having me. Great to be here.
Absolute pleasure, man. Thanks for taking time out of your busy schedule. Now, just to jump right into it, I am really curious because AI is a huge buzzword right now. Everyone's talking about AI. It's become kind of like in the layman's terminology. But we've really only started getting into it in dentistry, let's say, for the past few years. What was your journey? I had a bit of a little, research about you, and you're a super smart guy. You've done a lot of AI things. I think your previous ventures was like something called Gum and a couple of other AI tools. So what led you from that and your experience in AI to getting into dentistry?
Yeah. So I've really been in the applied AI space, specifically around computer vision, which is a form of AI where you teach computers to sort of see and interpret the world for the past 20 years or so. I'm an entrepreneur and technologist. I have a CS background. And I was really exposed to this technology initially in college, where I went to Carnegie Mellon, where I got my bachelor's and master's. And in many ways, it's shaped my professional career. And what's been interesting is just how markedly the accuracy and capabilities around the technology have improved. So, around 2010, 2011, with the advent of sort of modern machine learning and neural network-driven approaches, things have become extremely capable and powerful. I've been applying this to a variety of categories fairly successfully over time. And at my previous company, which we grew to, several $100 million in revenue, and I sort of started that company in 2008 and ran it for 11 years. At one point, I decided to start incubating some other concepts within that company because we were so ahead of the curve, having been steeped in the technology for so long. And I've had a very long-standing interest in, at some point in my career, I want to do something in healthcare. My previous company, I'm very proud of what we were able to accomplish there. But at the end of the day, we were selling a lot of media-oriented buying opportunities and targeting. I would not say we were definitely necessarily like improving fundamentally the world, but still proud of that accomplishment. But I wanted to do something that I thought would impact people in a more directly beneficial way. If you were interested in this technology, it's very obvious early on. I started incubating this in 2015 for dentistry, that computer vision was going to play a very fundamental role in the future of radiography and radiographic interpretation. My father is actually a retired dentist.
Right.
But when I decided to sort of incubate a new radiographically driven opportunity, I did look at various forms of medicine and ultimately landed on the dental category after a lot of analysis. And it's my opinion, I think this is bearing out to be the case now, that dentistry is very uniquely suited for the adoption of this technology much more rapidly than the rest of medicine. One reason for that is there's just a huge amount of utility if you take into account the fact that there's so much more radiography generated in dentistry than any other form of medicine. You also have a dynamic where there is a real lack of concurrence amongst practitioners when it comes to reading radiography. So, some stats that we quote sometimes, 43% of caries go undiagnosed. 20% of the caries that are diagnosed are not actually, decay. 49% of periapical lesions go undiagnosed. And we've run lots of studies around this, and they're published on our website. And if you look at any individual study, then you'll find just very striking results. In 1997, a journalist for the Reader's Digest decided to go to 50 states in the US and get 50 diagnoses and treatment plans from 50 dentists. And the treatment costs came in between something like $300 and $30,000. Then he went to the head of the ADA and he said, as a concerned patient about my oral health, like, what do you recommend I do? And the head of the ADA at the time said, we should get a second and a third opinion. He's like, I got 50 opinions and I'm totally not comforted, right? So dentists are these very unique entities in that there's just so much burden and responsibility on a dentist. And like reading radiography accurately is one of the many things that they need to do, but they're not staking their entire sense of sort of self-worth on it, right? So when we come in with an assistive technology, it's different than when you do that for a pure radiologist, because that is kind of all that they do. And there's a whole different level of, sort of relationship with that technology and potential threat and all that stuff. But the reality is, if you don't diagnose accurately at the outset, then everything else is not going to be optimal, obviously. So it's a very critical part of being able to issue good dentistry. And in dentistry and in many forms of radiography, it's just, this stuff is just really, really hard to see. You have a limited amount of time. You're super busy. You have 10 more patients coming in over the course of the day. You got to go to lunch. It's easy to miss interproximal decay. It's easy to miss early bone loss. And we surface, on average, 37% more disease per radiograph encountered. That's actually really beneficial because you're able to identify issues earlier and then act in a much more preventative manner. So it's called second opinion. We're not intending to take any autonomy away from practitioners. We just want to unburden practitioners and help them diagnose more successfully on a day-to-day basis by pointing out areas of interest.
Well, your dad must be super proud, man.
It's funny how it came full circle. He used to ask me if I wanted to be a dentist, and I was like super obsessed with, programming and technology. So I went a different route, but it all converged in the end. Yeah.
Well, considering your success, man, I don't think you made the wrong choice. But anyway, you must be proud regardless.
I do love this company more than anything else I've done. It's just a very gratifying and interesting work.
Yeah, I mean, look, from the dentist side, I'm sure you've heard it from your dad. It's an incredible profession, and especially at the moment, it's changing so fast and so much, and especially with people like you creating these tools for us, it's even better. I guess the other interesting thing about dentists is that we're all, well, not all, but a majority are private entities. So versus dealing with a hospital and trying to get them to agree to AI, I assume that kind of getting a dentist on board with something like Pearl is a bit easier than dealing with hospitals.
Yeah, so that's another characteristic of dentistry, that it's a very entrepreneurial sort of industry, and dentists are able to make autonomous decisions. DSOs are able to make relatively quick decisions. So rather than trying to spend, 7 years selling into some large hospital group, you're able to sort of go to market in a much more effective manner. Now, dentistry is also incredibly fragmented in every possible way. So you have just individual practices, but you also have a lot of fragmentation with imaging systems and practice management systems. So there's a lot of things to do right. We have a very multi-pronged approach to providing our services into the market. We work with large distribution. We have a large sales team, but we've also integrated our technology into 30 imaging and PMS platforms globally. And that makes it very easy to sort of adopt this technology in a turnkey manner. But I would say that that's a key challenge for any company in the dental category, is just how do you solve the distribution conundrum?
100%. Yeah. And we talk about it as like islands, and you're totally right. I mean, every practice has different technology with different software, and they all kind of coexist, and no one's really figured it out. Over the years, many companies, from the scanner companies to the PMS companies, have talked about solving this, and it hasn't really happened. Everything is really isolated, and now it's just like what your company has done. It's just integrations, and I think that's the best way forward.
I think if you look at change management is so critically important, workflow is so critically important. People like to live in a very limited number of environments, and they have a particular workflow. And requiring them to deviate from a particular workflow that they're very comfortable with is very cumbersome, and it's very challenging, even if you're offering a lot of value. So to the extent you're able to weave your solution into existing workflows, this is just a very powerful benefit to the end customer.
So I'm curious, you mentioned about AI and how it's changed. And I am very much so not a computer science guy, so I know basic level of AI. But I'm more curious about your vision and your initial vision with Pearl, what it started as, and how that's evolved with the evolution of AI, especially over the past years.
Yeah, so it's largely the same, although we've advanced significantly. And my whole, I'm a very product-driven CEO, and I really like doing new things. And my message to myself and the company and the board is always, we need to earn our way into being able to do more things that we think are fun and interesting and additive. and ambitious. And we've actually expanded the nature of what we do fairly dramatically. So one way to think about it is, if you look at our mission statement, is to kind of elevate the standard of care for billions of lives globally. It's very generic, but you could apply it to many dental companies, but we really believe it's true. And I think what's interesting is to dig a level deeper and say, okay, like what is Pearl's actual role in achieving that mission? And how are we approaching it? What new value are we adding? And the way that we think about it is, dentistry has gone from an analog state to a digital state. And now there's a new thing happening, not only in dentistry, but I would say societally and civilizationally, in that there's a cognitive layer being inserted into the reality of your day-to-day work. So we're obviously very focused on dentistry. If you think about the PMS today, it's a system of record, but there's a lot of interaction with it. You're kind of in there doing a lot of input. If in the US, you're doing a lot of insurance verification on the phone, and you're doing clinical notes, and you're doing charting, and on, right? And what you're going to see happen over time, and relatively quickly, I think, is the input layer is going to get automated out. And the PMS will still be a system of record, but it's not going to be the primary modality by which you interface with your practice and the insights around your practice. So we have a whole set of tools that we're kind of just launching, that do a lot of this automation. And, we're best known for Second Opinion, which is real-time, patient-facing diagnostic support. We also have a tool set called Practice Intelligence, which takes the data in the PMS and it marries it with the data in the imaging system. And we provide a lot of insights about the patient population and undiagnosed opportunity and lots of day-to-day, very additive activity for the front office and back office clinicians. We also are doing a lot of work in the LLM side, the large language models like ChatGPT, if you're familiar with that. So we have a tool that we're actually launching in 2 weeks called Pearl Scribe, where we do ambient listening and we write all the clinical notes automatically into the PMS. We have another tool that we're working on called Practice Genius, that is a chatbot and a set of agents that enable you to interact with the reality of your practice on a daily basis and actually give you helpful insights proactively. All of this feels like different point solutions today, but it all converges into one thing in the end, because all of these technologies really make each other better and build upon each other. If you're doing pre-adjudication, I know there's another insurance example of like different reality out in New Zealand, but if you're doing pre-adjudication and you're doing second opinion, those are it's basically the same technology for a different use case. If you're doing LLM oriented work in one regard, it's going to feed the other stuff that you're doing. So a lot of what we're doing is taking the magic of the latest and greatest in foundation models and applying it very vertically in AI, but in a way that is very professionally supported, has great distribution, has great integration into workflows, and is really built in a bespoke manner for the dental category. And CBCT is something that we're launching in the relative near term as well. So I would say there's a kind of an obvious imaging roadmap and then a less obvious holistic approach to how to create a lot of efficiency and automation in a dental practice.
Yeah, that's super cool, man. And that kind of leads me to my next question. I was going to ask why AI diagnostics, why that was the kind of first thing, but it seems like it's more mass market and it can benefit more people than doing something like AI CAD. Is that correct? Because less people doing CAD. Is that kind of why you landed on diagnostics first?
Well, I landed on diagnostics because it's such an obvious and beneficial application of computer vision. And we think of this as building a new standard of care. So if you look at the history of dentistry, the standard of care is always increased by virtue of some new technological invention, right? You have the high-speed drill, you have amalgams, you have the advent of, fluoride or, digital dentistry, like the list goes on and on and on. iOS scanners, these dramatically improve what you're able to do in efficiency and quality of care. We're sort of at the nascent stages of a new revolution in dentistry, which is the infusion of AI into various aspects of the category. Now, my background being so computer vision heavy, and that being a really hard problem to solve and also get regulatorily cleared globally, made it a very natural place to start because it's very fundamental to a lot of the other work that we do. Because historically, it was impossible to understand an entire patient population clinically, because no human's going to go through every single patient record on an ongoing basis. But now that's possible. And that unlocks a whole world of very interesting opportunity.
Yeah, I mean, that data must be incredible that you guys have and sifting through all of that. You touched on the scanners part. I mean, to me, it's like, why hasn't this been built into scanners? Are you in talks with some scanner companies? It kind of makes sense, like it's a capturing device and that, digital impressions taken. Why isn't AI, or why haven't any of the other companies figured that out, where AI can give you diagnostic information right there and then, or even information about your tooth preparation? Have you under prepped, over prepped, blah, blah, blah? Any idea?
Well, yeah. First off, we have some really exciting developments in that space and in partnership with some of these iOS companies. The second thing I would say is they are actually working on this internally as well and applying AI. So I would say varying levels of success and advancement somewhat today. But if you look at every iOS company out there, they have some level of AI-oriented support, like automated margin marking and stuff like that. And diagnostics is now becoming kind of a hot ticket item in that space.
Yeah, super interesting. You touched on regulation, and that's kind of the obvious thing that most of us think about in terms of the challenges of getting AI into healthcare, because there's so much damn regulation. What are some of the other challenges you faced getting it into the sphere? And especially if you compare it to your other AI businesses, is healthcare uniquely positioned that is very difficult? Is that why we don't have that many players?
Yeah, it's a massive undertaking. It's expensive, and it's also quite risky because you basically need to spend years organizing for, say, something like an FDA clearance. And then it becomes an all or nothing bet. Like, you're either going to get the clearance or not. And if you don't, you're maybe set back a year. You might not have enough money to last another year, right? So I would say that it's a high bar. Different countries approach regulation very differently. So we have regulatory clearance in 120 countries now. We have a lot of experience in doing this at scale. If you look at the US and Japan, they're very focused on clinical outcomes and results and validation. If you look at Europe, they're very focused on process and QMS systems. The fact that they're actually quite different in terms of the auditing and the management and the approval process makes it even more cumbersome. I mean, this is the price of being in healthcare, is, having the regulatory reality. I think, I'm generally a fan of it as just a consumer and a patient, because I want things to be regulatorily validated to the extent that they're, accurate and actually protective of patients. Although I think sometimes that goes off the rails depending on the region.
That's kind of what I'm hearing as well, is a bit too much. So is PERL or second opinion approved globally? Like, anywhere in the world you can use second opinion?
Well, 6 continents, 120 countries. Right. That Japan, for example, is actually not technically cleared yet, but it should be in the next, I think, two months or so. So that's been a massive undertaking because it's as rigorous as the FDA, but everything needs to be submitted in Japanese. And so, yeah, it's a lot. I would say we're not in every single country, but definitely most first world.
What was the hardest country? I assume, is it Japan? What's the hardest country to get approvals for?
The hardest was the US so far. I mean, maybe we'll say Japan in the end once that's complete. Japan's definitely.
Brazil is also very tricky.
What is?
Brazil.
Brazil actually wasn't super challenging relative to the US, but I would say that the EU is very challenging in an ongoing basis, just because of the copious amount of just like oversight and required systems that need to be built and sort of done correctly, and challenging for different reasons.
What's the easiest flip side?
Well, some countries will just take, if you have FDA clearance, they'll basically say, okay, you can operate in our, like Mexico is like that, right? So that's the easiest.
We have our own regulatory body in New Zealand, to be honest. I could be wrong. I think we just use
You guys have the TGA.
We use the Australian TGA. That's right.
Yeah.
As long as Australia says it's good for us.
Right, basically. And we're super active in Australia and New Zealand now. We have a lot of really exciting work happening there and deployments happening as we speak.
I'm in touch with you guys through McKinsey at Gamma Tech. Shameless plug to him. He's an amazing guy, and he's really pushing it on our side of the world, which is nice.
Yeah. Which imaging system are you on?
I use Cavo. I use Instrumentarium. So what's it called? Classic Dentist. I use it every day, and I can't remember it.
Are you on Media Suite or
Dental?
On which one?
In vivo.
Oh, in vivo. Okay, got it.
Yeah, and I use in New Zealand, Dental Exact basically has a monopoly on our PMS. It's still local based. It's not cloud. I mean that whole PMS space needs a shake up. If you're a really smart guy, if you could shake that up once you're done with Pearl, it'd be really good to get something a bit.
You mean accelerating the move to the cloud?
Cloud and better UI interfaces. I mean, some of these look really ancient, man.
Look, it's a very competitive, again, very fragmented space. It is moving in the right direction. It's very slow. You really can't. It's a 20-year commitment to get to be market share in the PMS space, and you have to do it really well. It's pretty brutal out there. Although I would say in America, especially, there's just a lot of players. And I think when, we do work in Saudi Arabia and the UAE, for example, and places like New Zealand, it's, definitely, I would agree with you that there's an opportunity to
clear monopoly, and it looks like Windows 95. But anyway, let's go back to and second opinion. I had a question about accuracy and trust. So I used Pearl, and I actually found it very interesting. I've been using second opinion for a very long time. I actually used 5 different AI softwares, all the main guys: Valmedi, Pearl, Diagnostic, some weird ones that probably don't have approvals. And I put the same bite weeks through all of them, same ones.
Okay.
And that's also good about digital stuff. And what's interesting to me is you get different answers each time. Mm-hmm. It's a bit like if you put a prompt in Perplexity, ChatGPT, Claude, you still get a different prompt. But I would say, what was interesting to me was it was never over-diagnosing. One thing I realized about second opinion, it was diagnosing correctly, I would say 95% of the time. If anything, sometimes it would lean on the side of caution. Is that kind of where you guys have? Is that by design?
No, I mean, this is what's so fascinating for us, and kind of we're always trying to dig into this question, because if I brought 3 more clinicians on, they would literally say you lean on the side of overdiagnosing, and we have there's so much excitement around this technology because it's visual, it's cool, it's really helpful. So we have really, generally happy customers, and they're posting on social media and all this stuff. But then you have some customers that are like, I hate this technology, not accurate at all. And they're using the same output, right? And we look at their radiography and we're like, what's different here? And you can't discern it. So it's one answer here is reviewing an X-ray there is a subjective element to it. And one of the things that we really favor very heavily in our training data is data that is also clinically validated. So that's super valuable, right? Because something looks like decay, but then it was actually drilled into and verified clinically, and then with certainty, and that leads to better models.
I've actually done that. Second opinion gave me something. I was like, is that real? But I'll just trust my AI overlords. And I got to it, and lo and behold, it was definitely decay.
Yeah, and that happens all the time. AI is inherently probabilistic, whether it's an LLM or computer vision, blah, blah, blah. So we're always trying to toe the line between sensitivity and specificity. Mm-hmm. And you need to make decisions about that. So that's sound accurate. And then you could also add, UI tools to enable clinicians to interact with that as well. But there is inherently a subjective element here. And there are certain challenges like cervical burnout often looks like caries. Do you actually want to detect caries on PAs or not? Because there's a lot of overlap and people typically don't, but then there's value in it if you do. And, so what we're actually doing increasingly is we're putting more control in the user's hands. We're actually adding a much more robust set of settings. So you can decide how you want to sort of interact with the tool with more granularity. But yeah, it's always very interesting to have this discussion. And we're always curious about it. But I would say that we're just trying our darndest to be as accurate as possible. And I think actually in the operatory, you want to capture everything, because dentists are smart enough often to know sort of how to interpret that. Yeah. If you're talking about something like pre-adjudication, you want to be very right? So the use case actually determines the level of sensitivity in many cases.
And are you happy with it as it is now? You think, yep, we got to that point that we wanted to with in terms of accuracy?
No, we release new models on average every 3 weeks.
Wow.
So things change dramatically all the time, and you will continue to see dramatic improvement or whatever remaining improvement there is to be had across every detection type. That is an ongoing effort.
That's amazing.
We're never actually going to be fully satisfied, but we still feel like there's more improvements that could be made.
And it's a moving target, I imagine. But how do you test accuracy in something like this? Do you just run? Do you have like an internal dental team, or do you just run through all your customers and key opinion leaders in
How
your
do we test for
organization?
accuracy?
Do you run it past your dad? How does it work?
Yeah, it's a great question. And it's actually a key challenge for any AI company because what you don't want to do is release something at scale that is somehow a degradation of
Yeah.
quality, right? So we have very robust systems in what we call different sets of ground truth and gold sets where we measure the F1 score. So an F1 score is a measure of sensitivity and specificity. It's actually a score of your detections. And we're very rigorous about making sure that the underlying data, first of all, is massively accurate, and then making sure that we're driving net improvements over time. The only way to do that reliably is technically generating F1 scores at scale across multiple different image sets. Otherwise, you're bound to make an error.
It must be, yeah. I just can't imagine how hard of a task it is to test accuracy like this and then have the guts to release it in the world because your company relies on it, man. It's like it must be such a challenge.
Yeah, and then like, look, we're operating at pretty large scale now. So when we make a change to like a bone level detection, it gets noticed, and people say like, hey, what's going on here? This is more conservative now, and like we're just like, I think it's just more accurate, right? But yeah, it's definitely one of the challenges. But we really always want to reinforce the fact that this is truly a second opinion, and the clinician is.
By the way, whoever came up with that name is a genius. If it was you, Ophir, you're a freaking genius, man. That name, Second Opinion, is.
It was me, but it was like what we called it from day one because it seemed like the most obvious name, and I think it's been used elsewhere, different applications, so I can't fully take credit.
Yeah, I mean, like, look, it's dentists get very cagey with someone telling us what to do in our office.
Yeah, totally, absolutely. And like we really view we love providers and dentists and dental practice, and that is our primary stakeholders who we think about every day. Everything else is kind of secondary and in service to providers, and we really see part of our job as like unburdening. Like I watch my mom and my dad. My mom ran the practice. My dad's a practitioner. It was a very classic story. And you're running a payroll, you're running a staff, you're running an office lease, you're running equipment, you're doing treatment. It's a lot.
It is. Yeah. And so about Pearl, I mean, you recently, I think it was a couple of months ago now, raised some capital, and a big congratulations. I think from memory, I read it was the largest ever raising of capital in dental AI. I think it's something like 58 million. Yes. Congrats, man. That must have been a very, very proud day for you.
Yeah. I mean, look, I don't get too excited about raising capital. I've raised probably $250 million in my career. And really what it does is it layers on a lot of responsibility. And now the bar that you need to achieve in order to have a, quote, successful exit for your backer is much higher. So it's a lot of responsibility, and it's just a tool to kind of try to accomplish what we want to accomplish. I'm very much in awe of bootstrapped companies that go from, 0 to 20 over some period of time without raising capital. I mean, there's all types of ways to sort of skin the cat. We're trying to do something that is much more kind of home run driven in terms of having a really big impact on the world relatively quickly. And that requires a lot of capital. I would say that the AI game in general is an expensive one to do well.
And it must be kind of reassuring for you as well when you do something like that. It's okay, we may be to something here. Or did you know that years ago?
I really had a thesis about the market. I think that thesis is bearing out. And, if you're trying to do something net new and transformational, it really helps if you are able to predict and ride a wave of inevitability. And I think we're on a wave of inevitability as it relates to the infusion of AI in dentistry. But yeah, look, the first few years are super hard and stressful and uncertain. So it's much more fun to be fighting to grow and to add value than to be fighting for survival.
Yeah.
That's not that fun. And there's no way around that. You have to go through that period with every net new venture of this nature.
Probably every company goes through that, right?
Yeah, for sure.
Speaking of that inevitability, I want to touch on adoption and growth. So are you seeing mass adoption around the world? Is it some markets adopted? I would assume the States. The States seems to be the leader in everything digital dentistry, but is the growth levels where you're expecting and where you were projecting? Is that people are accepting of this technology, or do you feel like
Yeah,
you're a bit?
people. I got asked on stage recently, like, "What do you want to tell dentists so they adopt this more rapidly?" And I'm just like, I'm pretty satisfied with how the adoption is going because, like, people need to get educated, they need to get comfortable, and then they need to adopt and have a good experience. And I think it's happening at a good pace. Of course, selfishly, do I want it to happen, faster? Sure, whatever. But like when I'm looking at it, sort of just from an independent perspective, I think that the industry, it's a great one. I love like working with dentists and practices because I think they are well intentioned, they want to do good work, they want to adopt technology, they want to know that it's actually adding value into their reality. And yeah, the US is our largest market for sure, but we are seeing very rapid adoption in the UK. I think we're going to see extremely rapid adoption just because of the massive queue in Australia and New Zealand that's built up over time. Northern and Southern Europe, Scandinavia, UAE, so, pockets of South America, Canada. We're seeing it happen everywhere, but I think a lot of the world still doesn't even know that this exists.
Yeah.
Like our challenge is education more than sales. Like if you educate people about this, they often want to sort of embark on the journey and adopt the product, but they just don't know it exists, right? So we do a lot of work around education.
Yeah, 100%. Especially, and I feel like now is a good time. Everyone kind of uses ChatGPT. Everyone appreciates AI a lot more and sees it as collaborative rather than it's taking my job.
Yeah, doing a lot of work for everyone in AI just because it's made it so mainstream. And it also showcases how phenomenally capable the technology has become, which is astounding even to me.
Totally. Everyone I use, I was mind blown. I mean, anyone who uses AI in diagnostics, because as dentists, we kind of have this kind of bravado, like we spend all these years studying and I'm a dentist, I'm the hero of the clinic. And then you put an x-ray through AI and it picks up things you didn't even pick up. And you're like, oh, okay, that's incredible. We kind of spoke about this at the start with radiologists where their whole job is kind of x-rays and diagnostics. With dentists, it's not our entire job. Our job is doing dentistry. So do you feel like there's less of a AI is stealing our jobs in dentistry? You don't really get that, or is it still there?
No, that's what I referenced earlier on is that like one of the features I really like about this is we're just not inherently threatening the people's livelihoods. And you can't deny that AI is a cognitive tool. It replaces cognitive tasks, sometimes complex ones, or at least has the potential to do that over time. So there's a lot of resistance in general in radiology, for radiologists with the technology. Now, there's a lot of embracing of it as well. I think the way that I've heard this reference, and I think it's true, and a good way to think about it is AI will not replace humans in relation to radiographic review and other tasks, but like humans that choose not to use AI will be replaced by the humans that are working with the AI, right? And I think that's fair and accurate. But yeah, I mean, look, it wouldn't be super fun to be perceived as a threat fundamentally all day, every day. And I'm glad that we don't.
Welcome to the life of a dentist where a patient perceives you as a threat. It's like, I hate the dentist almost every day.
Yeah. From a communication perspective, have you found this to be a very useful tool in just stepping the patient through a visual narrative?
Hugely. I'll have to send you the review I did on Pearl AI. I was going through McKinsey.
And I might have seen it, but it's not even associated with you.
Yeah, no dramas. I'm sure it would have gone through the AI, the Pearl channels, because I got some emails from your team. But anyway, yes. And the short answer is yes, totally. I've never seen a patient that was like, oh, this is strange. It's always, oh my God, this is crazy. And the interesting thing is then you're seen as advanced, even though you just kind of click the button, is that then the patient perceives you as super high tech and you know what you're doing. Because
how much do you guys lean into that as a practice? And if so, like how much do you market it?
We don't. I'll be honest. Look, in New Zealand, at least, we're not like as good as, let's say, the average marketing in the States. The States is like, you guys' marketing levels. I know because I hired an American agency to do some marketing for us. They're called Progressive Dental, I believe. They did all these videos of marketing, and they go to the patient's house, and it's a whole journey. You don't get that stuff in New Zealand. We're very much a bit like a hermit kingdom. But I would say if you wanted to lean on it, you totally could. And I do think, I'll put it this way, let's take a different outlook. maybe not the AI side of things, but I did an advertisement, super low budget advertisement on 3D printed dentures in the newspaper. We got tons of leads. So patients are going full force into this technology thing, and they do want practices that are high tech. And that's kind of been, I think, part of the reason why we've grown a lot. Like we operate 41 chairs in New Zealand.
Wow.
Yeah. Pretty big operation for a family business.
Wow. Yeah.
Yeah. And so we've leaned really big into CAD CAM and digital dentistry and scanners and all of that.
Yeah. I don't think most patients have ever understood what they're looking at when looking at radiography, because, they're looking at a bunch of gray smudges on a thing. And it's like a great moment when you're able to look, show the anatomical tooth segmentation and then some form of, condition, tooth parts.
Yeah, that's the other genius thing. The first genius thing was second opinion, the name. And the second thing I loved is tooth parts. To me, frankly, and I write this in the review, I have to share it with you. To me, how I see AI is like 50% diagnostics, 50% communication tool.
That's how I feel about it myself.
Yeah, it's like mind blowing. And you're totally right, because you're pointing at these gray shadows on an x-ray and the patient doesn't really know what the hell they're looking at. It's like when we go to a doctor and they're like, oh, you have this. But you do the tooth parts thing and it's just, the whole thing sings, like the patient sits there, it's really clear. Don't let the red blob go into the purple blob. And that makes sense to them. And it's like, oh, okay, sweet. And the best part about AI is it takes you out of the whole discussion in a way, because most dentists are private practitioners. And so there's always that kind of weird element. I'm sure you know this. I'm preaching to the choir. Your dad's a dentist. But, patients feel like they're getting money grabbed by a dentist.
Yeah.
And you're overselling. And so the AI just...
Yeah, you're able to insert an independent sort of third-party entity effectively, and then that creates more
and it's not even
understanding.
a human third party. That's the best part, because even a human third party can be bad.
Right.
It's robot.
You totally get it. You and I share a lot of these opinions. Yeah.
What about, what sets second opinion apart from you raising a ton of capital, which again blows my mind. Like that sort of money is just like mind blown. So you guys do 6 detections at the moment. I think the tooth parts thing is like probably the best thing that you guys do. And also the integration and the UI looks really nice compared to other products I've tested. What else kind of sets second opinion apart?
One is just, we were the first company to receive FDA clearance for, pathology. And then there's obviously OPG and CT, and there's like the image sort of roadmap. But I think the thing that sets us apart the most is our focus on kind of the user and the user experience. And we have a pretty seasoned team that has built companies at scale. And I think the fact that we're able to offer this technology to so many practices with a thoughtful integrated workflow, and then support them throughout their journey, and are very clear in terms of what our roadmap is and what kind of our mission is, and who we're sort of servicing, actually is markedly different than I think other players in the space, in that we have a particular philosophy, which I think is the most obvious philosophy in the world. I think they have different philosophies. It's actually interesting to observe. Like, we'll see which philosophies play out, how and where, and how that all manifests. But I think we're just a very high quality organization and very committed to building a, scalable and transformational company in the dental category. And I think you're going to continue to see us sort of ahead of the curve in bringing all the pieces together to effectively create the practice of the future. Well, I would say the one other big differentiation is we are the only company that is global, literally. So we're very active in the US, obviously, but then have all these clearances. And what we like to say is to our partners, when I say partners, I mean, imaging partners, distributors. With Pearl, you build once and you deploy everywhere. So we'll create a go-to-market, we'll create a terrific integration. If you build it one time, well, you can now deploy it in 120 countries. And we have all the globalized infrastructure. We have all the regulatory clearances and red tape. So it just becomes very functional to sort of offer this across all geographies in which you operate. And most companies operate across many geographies.
You speak of the philosophy, if you don't mind me asking, of course. What is that kind of philosophy that sets you apart? Can you put it in like a sentence or two? Or
yeah, I really think it's about being, at least as really second opinion, the turnkey global diagnostic AI solution by virtue of being embedded in workflows. So it is really unique in that we are on 30 PNFs and imaging platforms, because anybody else, and there aren't that many companies doing this globally, but anybody else that is doing this is not doing that play. And I do think that it is a massive difference maker. And we see it on the numbers because, our churn, the users that cancel, especially on integrated workflows, is almost 0%.
Amazing. Question about that workflow thing. And I do have a request, a feature request, or maybe there's a reason why you don't do it. So other softwares, they just let you drag and drop x-rays in there. Whereas with Pearl, it has to be through the integration. You cannot just import x-rays. Was that a design choice? And is there an option in the future to have that? Like, I love the integration, the workflow. It makes total sense that I don't.
But do you have a store of data that you would like to drag and drop in?
Yes.
So what's that use case?
When the integration stops for whatever reason. That happened to me once. And and then if the integration stops for whatever reason, I'm not a tech guy, so I have no idea why. Then I can't use Pearl anymore. It doesn't upload.
It's something we actually do support. I'm not sure if you have it in your particular integration, but that support exists. And
right.
Our whole theory about this, again, on the workflow point, is like, if this is not happening automated in the background, it's going to get very tiresome and old to do drag and drop over time. But you're asked to be able to do drag and drop in a bespoke basis and manner, totally legitimate, and I'll make sure that you get that.
Yeah. I just mean, like, I totally agree, by the way. I've used other softwares, and I think you're 100% onto something. For any of this AI stuff, because a lot of companies talk about AI and like AI CAD, AI this, but if you're having, a patient, if a doctor sees 20 patients, they don't want to drag and drop 20 freaking x-rays. It all has to be integrated, automated. You just open this browser and there it is. And I feel like just even having it hidden somewhere in a menu that you can manually just put an x-ray in.
Well, we have some versions of our actual software where you can just literally drag it and drop it into the window and it just processes it.
Another question I had that's on top of my mind, is there any surprising ways that you've seen Pearl Diagnostics be used in the office?
Yeah. I mean, look, constantly. I mean, I'll give you a couple examples. I mean, one is, initially it wasn't an explicit use case in markets where there's a payer reality, where people started submitting their insurance claims with the Pearl evidence, and then like the acceptance rates just went way up because you've done the work on the part of the examiner. Another example is there's a lot of pre and post-op applications where there's a verification. Like if you do a deep cleaning, like is all the calculus gone? Or if you're a payer, I want to see like we're doing this in Saudi Arabia, actually, like the pre and the post, such that you verify that the work was completed. All types of novel ways that we're constantly kind of learning from the user base.
That's super cool. Is 3D X-rays high on the list? Do you feel like it's
3D? We're already in it with the regulatory agencies.
Oh, wow.
We've done all the training. It's extremely capable and robust, and we're super excited about it. So I would say we're right there. We actually expect to start receiving clearances in the next few months.
Oh, amazing. I look forward to that. And then LATSEP's high on the list for the orthos, or the side-on X-ray, the ortho X-ray?
It's on the list, but not one of the next three things that we're doing.
No problem. Good to know. I was just curious out of anything. Look, I am mindful of time because I know you have to go pick up your kids. So in the last few questions, what I wanted to really pick your brain is how do you see AI, reshaping dentistry? I was going to say in the next decade, but I think that's even too long. Maybe in the next 5 years. What are some, I feel like, how do you see it reshaping? Is there anything kind of like AI insights or trends that really excite you at the moment?
It's kind of along the lines of what I was talking about earlier, in that I think that so much rote, repetitive tasks, so many of them are going to be automated away. And it's going to be automated away in a very high quality manner. So like, if you look at the clinical notes that we're able to generate or charting, like this stuff is just like very laborious, and you still need it and want it for a lot of reasons, but you're going to be able to spend less time doing that and more time focusing on the patient care and patient communication and other things. So I think that we're going to move, I'll put it this way. If you look at the other technological inventions in dentistry, they tend to do a thing really well or a couple things really well. Like the high-speed drill, like super useful, right, for what it does. If you look at digital dentistry, pretty useful, but limited. And why is that? It's because you're generating mountains of digital data, and that's very portable, and obviously being digitized is great, but you're not able to make any use of it because you just so you have all these fiefdoms sitting on mountains and mountains of data with the total inability to actually leverage that data to drive a benefit, right? So that's what AI changes. And what's interesting about AI is it kind of touches everything and sort of improves so many aspects of the category in terms of modalities and specialties and functions and insights. And I really do think that you will find yourself interacting with your practice management data and the reality of your practice with an AI agent. And you're going to be communicating with that as if it's like the world's best expert on all the details of your practice. I think it'll be, great because it enables us to just run a much more efficient business and focus more on the things that really matter.
Super cool, man. And I guess in that light, do you see the future as in every clinic will be using AI? I mean, you never reach 100%, but do you see this hitting mass market very quickly?
I do think it'll be 100%. We think of this as a utility. Given enough time, of course, but I think this is a standard of care. I think it will become as fundamental as, water and power in a dental practice. There's just too much utility and it's not that expensive. So like when you combine those two things, and especially as the technology continues to improve, I don't think technology, it's almost like saying, like, will you be driving a car in 50 years? Like, probably not, because this is not how you get around. So I think it's, analogous.
Are you guys going to be at IDS next year? I assume so. Pearl always has a book. Do you personally come to that show?
We always go to that show. We always have a big presence. Yeah.
What about you personally?
I always go myself.
Oh, amazing, man. I look forward to seeing you there. I'll have
those little beers at all the Cologne pubs,
Yeah, no, I'll have to come say hi. Look, I'm very mindful of your time once again. And I guess this just the last kind of question to wrap this all up is, I kind of want to pick your brain about legacy. You've touched on this about what's next for Pearl right at the start with all the different ways you can impact and improve the efficiency in a practice. But I guess my question is, in terms of healthcare and dentistry and transforming these things, what do you hope Pearl's legacy is going to be?
Legacy?
Yeah. In the future and the impact.
I hope that Pearl could help propel dentistry from a technology and software perspective in particular to the forefront of medicine. So healthcare is always just like very legacy by nature, and the dental industry is extremely legacy. There's actually no software leader in dentistry that is not like you said, like Windows 95-esque. And I think there's a real void there. Now, one of the challenges in operating well in this environment is just being able to build out pipes that can ingest data, normalize that data, and then take relevant action on that data. There are so many companies that I talk to and look at and potentially want to buy or partner with or whatever in the category. They're all doing the same thing. They're all trying to capture normalized data. 85% of everyone's effort is going to that problem because it's such a fragmented space and it's such a challenge and you have to do it. And almost nobody is solving it well. And it's why a lot of companies are not able to get to scale. Now we have resources such that we're actually able to do that reliably. And I think that is a fundamental building block of just being able to build out all this value that we're talking about. So we would like to be a transformational software company that helps dentistry sort of dramatically advance in that sort of realm and context. And for me personally, I've done a bunch of companies. I don't particularly want to be the CEO of another venture-backed startup after this one. I'm in this for the long haul, and I think my team is as well. I think there's also like a real need for a set of outsiders partnered with a lot of insiders to move the industry forward, right? Yeah, to shake things up and just like modernize it, right? Be able to do all of that work across, like I said, like we're not building a PMS, and but I think that we're going to have a big impact in almost being able to leapfrog like the next great interface with an actual new modality of interaction, right?
Exciting times, man. Look, firstly, Ophir, I really appreciate your time, man. I know you're a busy guy. You're running an incredible business. I'm sure many other things. So thank you so much for joining the podcast.
Yeah, thank you so much for having me. It was really fun and always fun to talk to a customer, and especially one that gets it so well.
For those of you who are listening, definitely check out Pearl. I mean, they are the world leader in 2D radiography. You can easily find their website, and please, if you're going to IBS, check them out. The other thing is, you've heard they're going to be releasing some very exciting things in terms of 3D radiography and AI tools basically for the entire practice. So super exciting things to come, and it's just incredible to be in this industry. I'm sure you feel the same, Ophir. Just changing so fast. And, if you think about dentistry, kind of, my father's a dentist as well, kind of like how your old man did dentistry. For the longest time, it was silver fillings and PFM crowns. And, in the past 10 years, it has changed so much.
So much. Yeah. I mean, it's a very exciting time to be alive, honestly. Just shows like a human on this earth at this moment. We're talking about a very bespoke set of applications in a very vertical manner, and obviously very animating for both of us. But I think a lot of things are going to change fairly dramatically, and hopefully for the better over the next couple of decades.
For sure. Exciting times. Look, we'll have to touch base again, maybe next year or in 2 years or something.
Yeah, we'll definitely connect at IDS. I will definitely get you a drag and drop access, and
and we'll see. Maybe we jump on the podcast again in a couple of years, see how much it's changed. Right. That sums up this episode of the Digital Dentistry Decoded podcast. Thank you for listening, guys, and a big thank you again for Ophir, the current CEO of Pearl, who is no doubt changing our industry. Honestly, it's kind of mind-blowing speaking to someone who's had such an impact on dentistry, and I'm sure this is going to be the future. I don't think anyone has any doubt that AI will be in every practice in the future. It's just a matter of how long will that take. For those of you who are listening, like, comment, subscribe, all of the good stuff, and I will see you in the next episode of the Digital Dentistry Decoded podcast. Thanks for listening.